Hi, my name is Yesenia Hill, and today I'm going to present my presentation number 2, and this is based on assignment 5, part 2, which is the neck and larynx. So I'm going to start with the innervations and blood vessels of the neck. So starting with the blood vessels, I'll start with the vein, which is the internal jugular vein. Then we have the common carotid artery. And then for our nerves, we have the vagus nerve, the phrenic nerve, and the brachial plexus. So for the muscles, we have the anterior triangle, which was discussed in Dr. Squires' lecture. She mentions that there are two types of hyoid muscles, one that will elevate and one that will depress the hyoid, larynx, and pharynx. So I'll start by saying deep to all these muscles, you'll find the larynx and the thyroid gland. The mylohyoid, sternohyoid, and in fuchsia, the stylohyoid are all part of the suprahyoid muscles, which will elevate the hyoid, larynx, and so the omohyoid is part of the muscle group that is controlled with infrahyoid muscle movement, which depresses the hyoid, larynx, and pharynx. So the posterior and anterior digastric muscles are not part of the posterior triangle. The posterior triangles are part of three muscles. Well, there's more muscles, but three muscles that we've talked about in the lab, which is the anterior, middle, and posterior scalene. The anterior scalene is right above the brachial plexus. And these muscles are in charge of tilting and rotating the neck. And that is the muscles and innervations of the neck. And now on to the larynx. We have the epiglottis, the thyroid and cricoid ligaments. And I just did a lateral and a lateral cutaway, so you can see the muscles that are in the cutaway. And I also did the posterior, and I'm just going to keep the same, renaming the same structures so we know what's going on in each of these. So in the cricoid, we have at the bottom, and superior to that, we have the thyroid, and the muscle in between those is the cricothyroid muscle. And I'll go more into detail what ligaments are attached to these muscles in the chart below. So in the light blue, there's the vocal folds, which is something I'll talk about as a clinical case later. Then we have, again, a cricoid and thyroid muscle in the lateral cutaway. And a new type of ligament here is the arytenoid muscle, meaning ligament, and we have most of our muscles are attached to these two. So this is the lateral cricoarytenoid muscle. And then in red, we have the posterior cricoarytenoid muscle. And you can see it from the lateral cutaway and from the posterior part of the larynx. I'm just going to go ahead and rename these structures in the posterior view so we can have an idea of what they look like. So we have the glottis, the arytenoid, the thyroid, and then actually in dark purple we have the transverse arytenoid, and I'll explain why that is the transverse arytenoid. And that is the larynx. So now for the larynx muscles, the cricothyroid is connected to two ligaments, which is the cricoid and the thyroid ligaments. Then the posterior cricoarytenoid is connected to the cricoid ligaments and the arytenoid ligament. And the lateral cricoarytenoid ligament is connected to the cricoid ligament and the arytenoid ligament. And like I said, the transverse arytenoids are transverse just because they attached to the opposite sides of the arytenoids. So we can see that they go ahead and transverse, basically. And those are all of the blood vessels, the innervations and muscles, so the neck, and everything you need to know for the larynx. So now for the vocal folds, in a clinical case, I'm just going to go ahead and talk about what the vocal cords are and what they do. So vocal cords produce sound like I'm speaking right now. They protect your airway from foreign objects such as food and water. And most importantly, they are in charge of airflow in and out of the body. So whenever you do speak, the bands of the vocal folds will come together and vibrate to make the sound that you hear right now. So this vocal fold clinical case is actually called vocal cord paralysis. And in most cases, only one vocal cord is paralyzed. And I'll show you a picture at the end to see what it really looks like and why it's important to be able to have two functional vocal folds. So the causes of vocal cord paralysis has to do with injury to your vocal cords doing surgery, having severe damage could actually just stop your vocal cords working. And some of these surgeries can be from the thyroid into maybe your neck or your chest. Another type is trauma to your neck or chest area. Then you have stroke, tumors, infections such as Lyme disease and herpes could cause inflammation and destroy some of those nerves. And the last one is neurological conditions, which could be considered as Parkinson's disease. And that could, and also multiple sclerosis could be another neurological condition. So some signs and symptoms of vocal cord paralysis could be hoarseness of your breath, of your speech, noisy breathing, loss of vocal pitch. Another one is choking or coughing from foreign objects. The need to take frequent breaths while speaking, the quality of your voice, and sometimes which is linked to the vocal pitch, your inability to speak loudly, a loss of gag reflex, and lastly would be ineffective coughing. So all these signs and symptoms could be pretty severe, if not fatal, if you do not take care of it. So the vocal cords do two types of movement, which is the abducting and adducting. Abducting is when they open, such as when I'm speaking, or when you drink water, things like that. And the last one is adducting, when they close. Actually, this is when you drink water. My apologies. So the air doesn't mean your foreign objects don't go through this, the hole per se. And lastly, we have vocal cord palsy, which is one side paralysis. And that's when the vocal cord tries to shut, but it can't, and that's how that can lead to choking, ineffective breathing, things like that. So thank you for watching. I hope this helps. And yeah, thanks again.